Welcome to eMediCore Patient's Corner series. Today's discussion is about extracorporeal shockwave lithotripsy, also known as ESWL. Extracorporeal shockwave lithotripsy is a non-invasive procedure used to treat kidney and ureteral stones. The procedure takes approximately 1 hour and is normally done in a hospital or surgery center as an outpatient procedure. Deep sedation or general anesthesia is normally used during the procedure. Here is a diagram of the kidneys, ureters, and bladder. The kidneys create urine as a waste product from the body. The urine drains from the kidneys through the ureters and collects into the bladder. When voiding, the urine drains from the bladder and out into the external environment. Here is an overview of how an ESWL works. In this example, the stone is located in the kidney. During ESWL, the stone is located using non-invasive imaging techniques, such as ultrasound or real-time X-ray, also known as fluoroscopy. Once the stone is located, the lithotripter will focus high-energy shock waves onto the stone, shattering it into smaller pieces. This too is done non-invasively, meaning there are no cuts or incisions required. The procedure is finished once all the stone is completely fragmented and can no longer be seen in the real-time X-ray or ultrasound. You should not have an ESWL procedure if you have an uncorrected bleeding disorder, urinary tract infection, aortic swelling, another blockage besides the stones, for example, a ureteral stricture, or are morbidly obese or pregnant. Though ESWL is generally considered safe and non-invasive, there are a few risks associated with it, which include but are not limited to bleeding, bruising, ureteral blockage by stone fragments, infection, and failure to break stones. In preparation for an ESWL, you will need to have a consultation with your physician regarding the risks, benefits, alternatives, and likelihood of success. Diagnostic tests and a history and physical exam will have to be done to ensure that you are in good medical condition for the procedure. Be sure to let your doctor know the names and dosages of all medications, of any allergies you may have, of any bleeding disorders, or if you are currently pregnant. If you are taking blood thinning medication, you may need to stop them temporarily. Be sure to discuss this with your physician. Be sure to arrange for a driver to drive you home. Do not eat or drink anything for at least 8 hours prior to the procedure. Be ready to arrive at the surgical center or hospital approximately 1 to 2 hours before the procedure. When at the hospital, you will be asked to change into a gown and remove any jewelry. You will meet with an anesthesiologist who will answer any of your questions regarding anesthesia. An IV or intravenous line will be inserted into your You will be positioned onto a lithotripter table similar to the one shown on the right. You will be given deep sedation or general anesthesia to ensure that you will not experience any discomfort or pain during the procedure. Finally, you will be scanned using an X-ray or ultrasound. This will allow your physician to locate the stone. The X-ray or ultrasound will monitor the stones in real time. High-energy shock waves break the kidney stones into smaller pieces. The procedure will finish once the stone is completely fragmented and no longer viewable on the monitor, or the maximum number of shock waves have been delivered.
Sometimes, if a stone is too large, a ureteral stent will be placed. A stent is a flexible curve-shaped tube that is placed in the ureter. The stent helps keep the ureter open and helps pass the fragmented stones from your kidneys to your bladder and out with your urine.
After the procedure, you will be brought into a recovery room and monitored for an additional 1 to 3 hours. A urine strainer will be given to you to collect any passing fragmented stones. You may experience discomfort when you pass the stones. It may take a few days to weeks for you to begin to pass the fragmented stones. A stone analysis test will be performed on the collected stones. A follow-up appointment will then be required. Dark or slightly bloody urine may persist for a few days after the procedure. Notify your doctor if you have fevers or chills, severe bleeding, experience intolerable pain, nausea or vomiting, or have urinating problems.
eMediCore, core medical education. For everyone.
From everywhere.
Forever free.